Good afternoon. I'm here at Volunteers of America Early Recovery Program in Arlington, Virginia. My training topic is empowerment theory, which is compatible with the strength, perspective, and the structural approach. I'm just going to pass these out to you. Take one and pass it down. Thank you. Okay, my training topic is empowerment theory, which is compatible with the strength, perspective, and structural approach. Our clients have substance abuse dual diagnosis issues, meaning they have substance abuse and mental health issues, and some are homeless. I believe that we try to empower our clients to empower themselves with our structured program. Our groups here, our group's focus is on self-esteem, self-efficiency, self-assertiveness, self-confidence, anger management, we have clients' presentations. Also, we have relapse prevention and recovery process. We provide resources, referrals for housing, education, and jobs, in addition to medical, dental, and psychiatric support systems and more community linkage in which reflects the empowerment theory concept. First, I would like to define theory. Theory is a set of ideas that help to explain why something happened or happened in a particular way. It predicts likely outcomes in the future based on evidence and reasoning, but have not yet been conclusively proved. The limitations in the empowerment theory concept is no single theory can explain everything. It does not work for some people. Theory used in social work has roots in education, psychology, or management. Some of our primary contributors to the empowerment theory in 1980 are Carell Germain, Alex Gitterman, E. Cox, and Chatter G, and many others. I also would like to inform you that the empowerment theory was found in Jane Addams' work in the Settlement House in 1889. Okay? By utilizing the empowerment theory as a unifying framework, it presents an integrated, holistic approach to meet the needs of members of oppressed groups. The empowerment theory makes connection between social and economic justice and individual pain and suffering. This theory adapts the ecological perspective, which sees the person in a holistic approach, the goodness of fit, meaning the transaction or the interaction between the person and his or her environment. It also works on the macro and the micro level, which is the community resources, and the micro, which deals with the individual. It works with diverse population. It influences self-efficiency. It increases self-esteem and personal responsibility for one's own changes. The empowerment theory focuses on the client's strength rather than on the problem. The client solves his or her own problem, assists individual, groups, families, and community to discover resources and tools. Okay? The concepts. Helping the client to perceive problems clearly with Excuse me, Ms. Morris?
Yeah, I just had a question. Yeah, I just wanted you to explain what the ecological perspective was.
The ecological perspective is covering the environment and the client in the environment and the environment in the client, the whole picture, a holistic viewpoint of that. Okay, go ahead.
I was just going to clarify. So instead of just treating the client like in traditional psychotherapy, you're also working with the system.
Correct.
Okay.
Working with the system where, as I said, the macro and the micro level. The macro level is the community part, the resources, the outer part, which is the bigger picture, and the micro level is the individual. Okay? So now we're down on the concepts again, and the concepts is helping the client to find and make use of pertinent resources that could benefit them, creating a relationship in which the client can grow and work out problems, increasing clients' positive self-image, and overcoming stigma. Clients' ability to exercise assertiveness in collecting decision making, clients' ability to learn and access skills for improving personal and collective situations, and it's focused around client empowerment, utilization, eliciting from clients those strengths, resources, beliefs, customs, healthy habits, behaviors that are necessary to solving the presenting problem. It is non-confrontational approach. The client is not forced to cooperate in it. The emphasis is on client's perspective, speaking the client's language, working within the client's frame of reference, negotiating mutually agreement, treatment goals, and utilizing resources and strengths. The roles, procedures, and skills is cultivating of resources and strategies by collaborative partnership with clients and constituents. Attainment of personal and collective social goals through expansions of client strengths and capacities, addressing direct and indirect power block by focusing on both the individual or family and the environment. Notice that we talk a lot about the environment. Treatment, it deals with the environment as well as the client. The client affects the environment and the environment affects the client. Okay? And also the worker promotes reflection, thinking, and problem solving on the PIE. The PIE is the person in environment, meaning including the client's role and experience. The motivation is coming from the client. Everything resides in the client, not in the helper. Okay? Development of positive sense of self, knowledge of one's environment. And I thought this was quite interesting. Trauma and abuse, illness, and struggles may be sources of challenges and opportunities to best understand the client's perspective. The interventions to facilitate empowerment is accepting the client's definition of the problem, informing clients of their rights, basing the helping relationship on collaboration, trust, shared power, regarding the client as the expert, identifying and building upon the client's strength, raising clients' consciousness of issues of class and power, utilizing small groups, advocating for clients, facilitating class advocacy skill, mobilizing resources, and teaching specific skills. Okay? So, are there any questions? I want you to remember that every individual, group, family, and community has strengths. So believe in clients' dreams. We do have a few minutes. You want to ask a question? I have like about 1 or 2 minutes to go. Any questions now, Ms. Marsh? Ms. Lisa and Mr. Hakeem? And as you can see, I have a picture here of faces of homelessness and addiction, which is, they come in all faces.
Well, why is this theory especially good for our population?
I feel that, and that's why I said I believe that we try to empower our clients to empower themselves through our structured program that we have here. It's about empowering them to empower, to pull their strengths. What are their strengths? Because a person that has been using drugs for years and have mental order, they really don't know what they like to do. So pulling on their strengths to see
Uh-oh. Yeah.